This presentation will cover the implications of humanistic or client-centered therapy in practice. What is humanistic or client-centered therapy? Humanistic or client-centered therapy is an approach that acknowledges the self-worth of every individual. Within this form of therapy, it is the professional's responsibility to validate the client's sense of self-worth and dignity, which also aligns with the NASW principles and values. The key concept of client-centered therapy serves as guidelines for the social worker to help activate the change process within the client, a process known as self-actualization. Incongruence and congruence immediately follow self-actualization, as the client is able to identify anxious or dissatisfactory feelings associated with self-image. As congruence emerges, the client is then able to incorporate a healthy self-image that fosters change, growth, and healing. Unconditional positive regard refers to the authenticity, sincerity of the communication that embodies a high sense of self-worth. Lastly, empathy allows the client to understand and sincerely regard their own or another person's experiences. There are three defining theoretical principles within humanistic or client-centered theory. Principle 1 refers to problems arising when people feel that the locus of control is out of hand, ultimately causing feelings of being devalued to surface. It is crucial for the social worker to value the client's worth and dignity to avoid barriers in treatment. Principle 2 acknowledges the fact that change can and will happen when it is fostered by sincerity and authenticity. The social worker is responsible for creating a sincere and safe environment for the client in order to help them acknowledge the possibility that change can occur. Principle 3 affirms the belief that growth and change are an innate process. Again, it is the social worker's responsibility to avoid solving the client's problems and help create a safe environment to enhance the client's self-worth, which can lead to self-actualization. The worker should be aware of situations that may diminish the client's process of self-actualization, which can limit the client's potential. Taking a humanistic or client-centered approach to therapy allows the client and therapist to be on the same level in many ways. Because of this, this theory can be applied in many different practice settings. It is primarily used in psychotherapy, but can also be used in group settings, workshops, and educational settings when the participants are actively willing to make changes and participate. With this theory, the setting does not matter as much as it matters that the client is viewed as an equal to the therapist. By taking this approach, the therapist can help the client embrace their diversity and how they react in their own environment. Using cultural competence allows the therapist to treat a wide variety of clients and needs. In some cases, a client may be mandated, so the therapist would need to determine if the client is willing to use this approach. If not, the setting may not be appropriate. Again, the focus in this theory is the client's willingness to participate. A main strength of client-centered therapy is that it is consistent with the mission and core values of the NASW. It places emphasis on honoring self-determination and inherent dignity and worthwhile, displaying warmth and concern for the individual client. It also can be broad enough to be applied in a variety of social work settings, including all three levels of practice: mental health community agency, advocacy and community organization, and social service policies. In addition, because of the focus on the individual client and helping to meet their needs and goals, client-centered therapy is helpful in multicultural settings. It prioritizes the position of the client and demonstrates unconditional positive regard in working to achieve empathic accuracy when working with clients. While client-centered theory does have many strengths, there have been a few limitations noted throughout practice. Client-centered theory is currently not an established empirically supported treatment. It is commonly critiqued as simplistic, non-directive, and with little guidelines for practice in social work. The non-directive approach can be confusing for client systems that are expecting a direct approach and needing structure. With the time spent for client interaction becoming shorter and shorter, client-centered theory is also limited in the amount of information you can gain from a client in a short period of time when the focus of the approach is to develop a genuine professional relationship to foster change and growth. In conclusion, humanistic or client-centered therapy is an approach that focuses on a client's self-worth and self-actualization with unconditional positive regard and empathy. It is the social worker's responsibility to avoid solving the client's problems, instead to create a safe environment to enhance the client's self-worth, leading to self-actualization. Humanistic or client-centered therapy is broad enough that it can be applied over multiple social work settings and very useful when engaging in cross-cultural work. It can also be used in micro, meso, and macro practice settings and works best when clients are invested and willing to participate. A social worker must be aware of the limitations of this simplistic and non-directive approach, as it is not empirically established, has little guidelines, and many practice settings do not allow for the amount of time this therapy takes to be successful. Sources.